Os the Sanalai, that means good morning in Cherokee language. This presentation is entitled Of Two Minds, A Safe Approach to Bipolar Disorder by yours truly, Regelken Ollet. This is in partial fulfillment of the requirements for Registered Nursing Bridging Program for international educated nurses under the course of NRSG 1006-E01 Co-Ed Winter Mental Health Nursing, Saskatchewan Polytechnic, to be submitted to Leslie Sparling. Before we begin, let me share to you our presentation objectives for learning. The first is a psychological disorder, which is bipolar disorder, its types, and contributing factors. The second is structure and function of the brain that's being affected. The third is a nearing discharge patient profile. Fourth is nursing process, including its goal, intervention, and evaluation. The next one is pharmacological interventions, and lastly, patient resources. As known to some, bipolar disorder is formally called manic depressive illness. It is a mental health condition that is characterized by sudden mood swings, wherein these manic symptoms are present, as well as symptoms of depression. This is a lifelong condition that requires careful management since it is chronic and recurring. Many often, bipolar disorder stays undiagnosed, causing sufferers to wait years for a correct diagnosis and course of therapy. Bipolar disorder is characterized by changes in energy levels, mood, and cognitive capacity. To further understand this disorder, we will focus mainly on the three types of bipolar disorder. First is the bipolar disorder type 1. This is characterized by cyclical event between mania and major depressive episodes. Having at least one manic episode or mixed episode is what is referred to be bipolar type 1 disorder. The majority of persons with this type 1 also have depressive episodes. So depressive and manic episodes each endure at least 2 weeks, but both can extend for several months. So this is the most severe type of bipolar disorder. The second is bipolar disorder type 2, characterized by major depression and hypomania episodes are present. The sufferers will have gone through at least one severe depressive episode and one hypomanic episode. So hypomania is less severe and dramatic form. The third type of bipolar disorder is a cyclothymic disorder, which characterized by no major depression but with episodes of hypomania and depressed mood. So for at least 2 years in adults and 1 year in children, cyclothymic disorder signs of hypomania alternate with symptoms of mild to severe depression. As outlined below, the contributing factors leading to bipolar disorder. First is biological factors such as genetic or hereditary that tends to run the family. Neurobiological factor, wherein according to experts, a dysfunction with certain brain circuits and brain chemicals known as neurotransmitter is a contributing factor to bipolar illness. Mainly, the norepinephrine, dopamine, and serotonin are the three involved neurotransmitters with bipolar illness. Brain structure and function affected that we will discuss on the next slide. Neuroendocrine factor, wherein according to experts, a study has been done on the hypothalamic pituitary thyroid adrenal axis in bipolar illness. They have shown that hyperthyroidism is one of the medical anomalies connected to bipolar disorder. The second factor is environmental. Compared to patients with unipolar depression, people with bipolar disorder seems to have a greater levels of education and higher employment position. The third is psychological factors, wherein people from different cultures, psychological issues may manifest themselves in various ways. Moving on, this slide enumerates the anatomy and physiology of the brain that is affected with bipolar disorder. According to Phillips and Swartz 2014, functional imaging methods for bipolar disease show impairment in the prefrontal cortex area, which is linked to executive decision making, personality expression, and social behavior. Additionally, the amygdala, which is involved in memory, emotion, and decision making, as well as the hippocampus, which is predominantly linked to memory, both exhibit dysfunction. The typical emotional ability, enhanced reward sensitivity, and emotional dysregulation in bipolar disorder are caused by dysregulation in these systems. The gray matter loss in these individuals may be the cause of these anomalies. Now, let's take a look on a case of a nearing discharge patient named alias Maria O, age 23 years old, sexual gender identity female or she or her, culture Asian Canadian, Saskatchewan community living in Regina, living arrangement renting in an apartment, diagnosis bipolar disorder type 1, history of mental disorder, new onset, comorbidities, type 2 diabetes mellitus, and existing local support member of Asian culture group. Let's dive into the nursing process associated with this bipolar patient. First is we're going to use the therapeutic communication technique. The patient verbalizes, I feel completely useless to everyone and everything. The nurse should reply, I am unsure if I comprehend what you mean by useless. Could you share an instance where you felt useless? This is a type of clarification technique. It enables nurses to confirm that they comprehend what is actually being discussed and can aid customers in more fully developing their thoughts. The second therapeutic communication used is patient, I am not sure what my true emotions are. The nurse should reply, if you feel comfortable, please tell me more about the circumstances surrounding you, happy and sad moments. This type of therapeutic communication is encouraging communication. Elicit more details regarding the patient's message to be specific as possible so that you can fully understand their situation. Moving forward, this slide summarizes the nursing diagnosis, goals, intervention, and evaluation. The first nursing diagnosis that is considered the top priority is risk for injury. The goal is prior to discharge, the patient will show signs of calm and low energy. The nursing intervention is to reduce the stimuli, to lessen hyperactivity and distraction, offer a secluded quiet space with dim lighting. Take away any hazardous items that they may use as a weapon or possibly kill themselves with, and encourage physical activity because manic patients are energized at all times. To aid with hyperactivity and to divert them from risky pursuits, consider offering fitness courses or household responsibilities. And the evaluation is during the course of manic episode, the patient won't or will not hurt himself or others. The second nursing diagnosis that needs to be addressed to this patient is ineffective impulse control. The goal is the patient will express that they have no hallucinations and express when thoughts are not grounded in reality. The nursing intervention is to keep patients' attention to the present and reality, offer uplifting encouragement. As necessary, reorient the patient at time, place, and location to avoid falling into false ideals. Keep your discourse grounded in reality by talking about current events. So, as soon as the patient can distinguish between reality and illusions, give them encouragement and support. Evaluation. Upon discharge, patient will demonstrate strategies to stop intrusive thoughts such as shouting stop or clapping the hands. Pharmacological interventions in teaching compliance is important toward patient wellness. One medication that is important in treating bipolar disorder is lithium carbonate, with a therapeutic level of less than zero point 0.4 to 1.2 milliequivalent per liter. This is useful in treating acute and recurring manic and depressed episodes of bipolar disorder type 1. This is the first line treatment for bipolar depression. However, we should look for adverse effects such as fine hand tremor, drowsiness, dizziness, polyuria, mild thirst, mild nausea, and general discomfort, as well as weight gain. Medication compliance and education at home should be well taught to patients. First is to educate the patient to never take it in a larger or less amounts or more frequently than directed by the doctor. Number two is use milk or food with this medication as directed and take it after meals. Do not chew or crush the extended or controlled release pills, instead swallow them whole. Third is eat a typical diet, typical salt intake, and drink enough fluids, at least 2.3 liters per day. And lastly, make plans for routine checkups that include blood testing to gain the maximum advantages with the least toxicity. There are a vast number of support groups towards mental health that is available, such as Canadian Mental Health Association, Mental Health Clinic, Community Care Branch. These are some of the community support resources found in Saskatchewan. Moreover, there are also crisis intervention resources that is available at short notice to help resolve mental health crises, such as Saskatoon Crisis Intervention and Crisis Suicide Helpline. Together, let us make the individuals suffering from mental illnesses aware of the importance of mental health and always remind them that they don't have to struggle alone. Make them believe that there's always hope, even when your brain tells you there isn't.